Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Tuberculosis, TB for short, is caused by bacteria that most often affect the lungs. In 2021, 1.2 million children fell ill with TB globally. Child and adolescent TB is often overlooked by health providers and can be difficult to diagnose and treat. Yet, according to the World Health Organization, globally, TB incidence is falling at about 2% per year. An estimated 66 million lives were saved through TB diagnosis and treatment between 2000 and 2020. It is spread from person to person through the air, but is curable and preventable. About a quarter of the global population is estimated to have been infected with TB bacteria, but most people will not go on to develop the disease, and some will clear the infection. Those who are infected but not yet ill with the disease cannot transmit it. National tuberculosis case finding in Nigeria has increased by 50% in 2021. The WHO says this took place by applying innovative approaches. My guest on the show is infectious diseases physician at the Lagos University Teaching Hospital, Dr. Iyonhe Akase. You're welcome to the show, sir.
Thank you very much. Happy to be here.
So we have increased in our TB incidence find. But before we go to that, let me just ask you, when does a person begin to suspect that there might be TB? Like, are there symptoms that send a person to the doctor?
Yes, so TB, to start off, presents in many ways. We know that the commonest form of TB is the one that affects the lungs. It's called pulmonary tuberculosis. But TB can affect any organ in the body, the brain, the skin, the eye, just any organ.
As a first incidence?
Yes.
Or doesn't it spread from the lungs?
Yes, it can spread from the lungs. But the initial part of infection in the lungs may be silent. So the first time they are presenting may be with TB in these other places, because the one in the lungs could have been silent.
Better to find it before that time then.
Exactly. So the presentation will depend on which organ the person is coming with at the first time.
Okay.
But as a rule, since it's an infection, they are going to have in more likelihood they are going to have a fever, which is not that kind of high-grade fever, but slow, just fever that doesn't just go away for weeks, months, sometimes.
They're just warmer than usual. And it just keeps on and on and on.
Exactly.
Okay.
So it's this kind of thing. I say, I'm treating typhoid. It's not. So fever will be going on for a while. Then they'll be losing weight. Some will be losing weight. Okay, sweating excessively. Okay, and then if it's in the lungs, they will hear the history of cough and all of that. So when you see someone having a cough, losing weight, having a fever that's going on and on and on, and then sweating excessively as if they poured water on their body.
Wow.
They may be having TB. So any one or two of these, even with or without a cough, should make the person think, well, you know what, this may be TB and I need to get it.
Okay, so following through with that, how long is it likely to take between an infection and actually when the symptoms begin to show? When the person starts to infect other people?
Okay, so this is a very good question. Now, somebody can get exposed to TB from childhood and not present with infection until adulthood. In fact, it can last some time, a lifelong. And without jumping, this is what is called latent TB. So for all we know, in fact, the expectation is that in a country like ours,
it's almost chock full of latent TB.
Lots of people walking around have latent TB, and they will present when something triggers that TB to now become reactivated.
What could that trigger be?
So this trigger could be from stress, other infections like HIV, malnutrition, diabetes, other, heart failure. Yes, diabetes suppresses the immunity as well.
Okay, it's an immunosuppressant.
It's an immunosuppressing disease.
All right.
So
that
all these things.
Bring it up.
And the TB is just lying there, latent, quiet. Latent means it's hiding, not causing sickness, but the person has the TB.
And according to what the WHO says, such a person cannot transmit it.
Unlike
Yet.
if it's not coughing, yes, it cannot transmit it yet. So, but the people who are the most risk for transmitting are those who are actually coughing, because that act of coughing is what expresses that TB into the atmosphere, and others can then inhale it, and all of that. So,
if one should come into contact with such a person's saliva, even though the person is not coughing, can the person get TB?
Well, in theory, it's unlikely for somebody who is not coughing. Okay, because these bacilli are in the lungs, so that act of coughing expresses it into the air.
Okay.
So in theory, it's a possibility, but in practice, it's unlikely. Yeah.
How many people is a TB, let me say positive person, likely to infect?
Okay, so that figure depends on exposure. So for example, if that person has entered into a large community, and there's what we call contact. So contact time in TB talks about the setting. So for example, if you have TB, somebody cough with TB that is a place that is poorly ventilated, he can transmit it. And then the people have been with him for 15 minutes or more, they can, get that. Yeah. So
as long as he's coughing.
So once he's coughing, yes. So you don't want. So it depends on these conditions to fit into place, and also those people too, how immunologically fit they are, whether they're immunocompromised or not. So there are a lot of factors, and that's one way of preventing TB. These are all the things you need to look into to make sure that, so in hospitals, for example, we do expose to a lot of people with TB, but we make sure our windows, that's why hospital windows are very big and wide open. There's a lot of ventilation.
And that's why you still wear masks sometimes.
Yeah, we do that to protect us. So when you put that in place, then so it depends on all of these that can, can determine.
Let's come to this innovative approach that, we're talking about, that the incidence find has increased by 50%, which means they are finding many more cases.
Yeah.
And that's because of some approach. What is this approach?
Okay, so the approaches to TB finding, one involves the clinical aspects as well as the other aspects that engage the community. So for example, in the clinic, you expect somebody who is sick to come to hospital, and then you say, what is wrong with you, and you pick that up. But we know that now there are people in the community who are not coming to hospital. So some of these innovative approaches, some of them use what is called contact tracing. Somebody has TB, you follow him back into the community. How many people has he been exposed to? You track and find. Some of these are now using technology to track, okay, this person has TB. Using where is his address, you can put that on coordinates and locate that, okay, in this community, it's in Mushin, 3 people have come from Mushin with TB in the past 1 week. That means something in that Mushin needs to, it's an example, Mushin is an example.
But that's the technological aspect you're talking about.
Yes.
That's what I'm interested in.
Yes.
So that's how it's done.
So that's one of that. You use that and track and say, okay, this area is a high-risk area. Something is going on there. We need to find out what it is. So, they go and look at it, what's going on there, in terms of both clinical and non-clinical things. And, just ask questions and find out what really.
Now, some of these finds, do the people already know they have TB, but you surprise them with it that, okay, you're a contact, we just like to test you. Do you sometimes find TB there?
Yeah, sure. So for example, you have someone who has been exposed to another person, and this person has now been found to have TB, but he found out actually I've been unwell for a while, but somehow he just takes it down to maybe age or some other thing. You check him out and find that he has TB, active TB. Of course, there are those who may not have symptoms, but he may have what is called latent TB now. So in tracking that kind of person and doing a test you can do to detect latent TB. So you do that kind of test on him and provide treatment. It may not be the same type of treatment as the one that has full-blown TB, but we pick that kind of latent TB and treat them, because you can establish that he has been exposed to this person. This person has TB, likely
and he might soon begin to get active symptoms.
Exactly.
Okay, so more TB is being found. In fact, 50% is a lot.
It's a lot.
You used to find 100, now you're finding 150. But can you tell, in the midst of all this, whether the TB cases have gone up or whether you're just finding more?
Exactly. I say this is this is a discussion that has gone on. You know that COVID, so COVID in 2020 affected a lot of things. In fact, TB case finding had dropped because a lot of resources have been converted to COVID care. People were not coming to hospital because they were afraid of COVID, lockdown, and all of so on and so forth. So subsequently, that uptick in detection, it needs to be interpreted in context. Is it, 50% increase from 2020 or 50% increase from pre-COVID?
Okay.
Because if it is 50% increase from pre-COVID, that means something really is. But if it's 50% related to 2020, then clearly it's just because the health systems are recovering from the lull that was experienced because of the COVID.
Not such a clear picture now.
It's not such a clear picture. It could be that, we're going back to normal. Clearly, globally, there was a drop in TB case detection 2020 in 2021.
That's how COVID affected us.
Exactly. So, but, after then, there's a recovery. So, in a way, it's a good thing, and it tells us that, yes, the health system is, coming back there. Whether it tells us that there's more case of TB in the community, is unclear. Of course, we know COVID predisposed people had lungs. Some people had lung injuries, so COVID may have predisposed some people to have that. But
yes, long COVID actually affected the lungs more than anything of people. Can you tell us, what is the connection between TB and under or malnutrition? Okay. This is not a sick person.
Yes.
It's just about food, right?
That's right. So here's the thing. TB, active TB, is a function of the immune system. Now, the aspect of the immunity, without going into too much technicalities, is that once somebody gets infected with TB, the body builds a fence around the infection. That way, the bacilli, the organisms are still there, but are unable to spread and cause more damage. So they build a wall around it. Now, anything that can affect the body's ability to build that wall, which is food, is very important for us to build our immunity. So people who are malnourished and who also experience other forms of immunosuppressive conditions, that wall breaks down. And so the bacilli can now, not that they can get TB, but those bacilli that have been walled off in a particular part of the body, now the wall is broken down, the bacilli can start spreading through the body, and the person now has what is called active TB. The person always had TB, but it was latent.
But the TB couldn't express itself.
Exactly.
Before.
Now they're immunocompromised, they're malnourished, they don't have enough, resources to build that wall again. The wall gets broken down.
But this is about food.
Exactly.
So I'm interested in this food.
Yes.
What is it more than vegetables and fruit that builds the immunity of a person? And fruit can be easily accessed. Fruit in season.
That's right.
It doesn't have to be some highfalutin foreign fruit. And it doesn't have to be some imported vegetable.
That's right.
What is the problem?
So you can look at it as, malnourishment or malnutrition can be both under and, in the sense that they don't have enough food to eat. Or the people who are eating wrong.
Okay.
Where you go to things like, we're talking about cardiovascular disease in terms of, overeating also.
Maybe they're eating fast food?
Exactly. So that is another form of immunity, because cardiovascular disease on the long run. Exactly. Those on the long run also have effect on the body's ability to handle some of those things. So it really is, a problem.
Okay, let's go to the one about children. WHO says children are a case apart. It's difficult to diagnose them. Why is it so?
Okay, so again, if you understand, like we mentioned about immunity, most of the hospital diagnosis we make is a function of how walled off that TB is. And an individual, so a cavity, for example, which is where the TB infection has caused a problem. When you're coughing out, you're either coughing out the disease part of the body, which can be taken and a diagnosis made. In children, because their immunity is not that well done, they're unable to wall off that TB in one place, that they can cough up that easily for that diagnosis to be made. That's one. Two, there's a way to cough up sputum that it can be used to make a good diagnosis of TB. Children are unable to be tutored in a way to gather and cough up that kind of...
It needs tutoring.
Yeah, it does. Because you can't just bring saliva. It's not saliva. It has to cough. Sputum can be coughed up from the lungs and coughed up you know, and brought out. So sometimes training, and children cough and swallow. You know, children sometimes when they're having the cough and swallow it.
Ah, okay.
So sometimes, you know, so these are all the getting challenge. That are challenges with getting samples from children.
We're going on a break, but I need to ask you something about this swallowing when we come back. Please stay with us. We are coming shortly. Welcome back. We're talking about tuberculosis on Channels TV. This is Health Matters. You can call 0808-054-2233 for your questions on tuberculosis. You can also tweet at CTV_Mary A, or just send me email, moalale@channelstv.com while the show is on. We are here with Dr. Iyonhe Akase. He's an infectious diseases physician. We were talking about coughing and spitting.
Yeah.
Now, we know that spitting is not a good habit.
That's right.
They say you shouldn't spit on the road, you shouldn't spit around, apart from the fact that it's nasty. It can spread disease.
True.
So what does a person do when a person is coughing up? Do you advise the person to stay home and be spitting into the sink or some receptacle, or should the person swallow?
Okay, so it's not encouraged to swallow.
Not encouraged to swallow.
What they're advised to do is to get a container that has a cover, and that it can have some sand on that, put some sand in a cup or something.
That sounds like a pregnant woman's.
It's safe because you can do that and dispose of it, and all
in
that.
A safe way.
In a safe way, without endangering, others, and all of that. And in children, why this again is, we're just talking about children swallowing, and this is one way that children, TB can spread, involve
because
other
they keep
organs.
Taking back the saliva.
Because they swallow the sputum, and it gets that and then it can, infect other organs, the liver, the intestines, and all of that. And that's where they can have TB that is called extrapulmonary. It's no longer in the lungs, it's now affecting other organs.
So I take it then that sputum is the best way to give a definitive diagnosis of TB.
The best way to make a diagnosis. In fact, one reason why, again, it's difficult to make a diagnosis in children is that because of what we said, they may also have TB spread to other parts of the body.
But what do you do with TB in other parts of the body? How do you find that?
Exactly. And that's why making a diagnosis in children can be difficult. That's one of the reasons why. Because they may come with TB in the liver. Okay, wow. You can go do a biopsy, get a piece of the liver, go do that. But sometimes the yield is not very good. So sputum, going back to your question, good quality sputum remains, and that is why once somebody is coughing, you don't wait for him to be very, very sick before he comes. Why he's still strong and able to produce good sputum is the best time to make that diagnosis.
Take him to the hospital and get a diagnosis. Okay, what is the best way, the most effective way to prevent oneself from getting TB?
Okay, so the prevention of TB involves it involves many strategies, but clearly, from a community point of view, is to identify those cases early and start treating, because when you start treating, you protect others.
Okay,
so
let's get this call from Victor. Hello, Victor. Hello, Victor.
Hello.
Yes. Yeah.
Hello.
What's your question, Victor? We can hear you.
Hello.
Hello, Victor. It appears Victor cannot hear me.
Hello.
So please try again, Victor.
Hello, can you hear me?
We can hear you. Can you go on with your question?
Okay. I want to ask, is tuberculosis treatable?
Okay.
Way to find out if it's in the blood or through the sputum, you can detect tuberculosis. And if a child is coughing, how would you detect if it's tuberculosis and the child has already taken several antibiotics?
Okay.
What can be...
You must have just joined us, Victor, because we're handling that particular aspect, but I'll put it to Dr. Akase. He's talking about detecting tuberculosis in a child who has had other antibiotics.
Okay, so antibiotics generally...
And how do you also detect tuberculosis generally?
Generally. Well, antibiotics do not really affect detection rate for TB because they don't treat TB. Good. So most time, in fact, you hear if it's TB, you get a history that despite taking antibiotics, they're still still ill.
It doesn't mask it.
It doesn't mask it. It doesn't mask it.
At least that's one good thing, that it doesn't mask it.
Generally speaking, yeah.
Okay. So you talked about case treatment, detection. But isn't there a vaccine?
Yes, so that's one pillar for vaccine. One pillar is early case detection. The second pillar is that of vaccination. But the key of vaccination is that it's usually given in children.
Yes.
And that vaccine, the primary function, is really to prevent children against, this severe form of TB.
Which means the children can still have TB, but it won't be severe.
It won't be severe. So in theory, yes, it protects against getting TB generally. Okay, but as people grow older, that immunity sort of wanes off and doesn't become, that.
We'll talk about that waning off. Let's take Joseph first. Hello, Joseph. What's your question? Hello, Joseph. A bit of trouble with the lines there. So you were speaking about.
Okay, I'm sure you can hear me.
Okay,
good afternoon.
Joseph. Yes, good afternoon.
Yes,
what's your question?
Okay, thank you very much, Doctor. So, I just want to ask, how do we differ tuberculosis from a very dry cough, right? So, there are times you have very serious cough that comes in from your lungs and it's dry. So there's this fear that, okay, this serious thing, then, your friends that is one. And then two, I told the doctor talking about how you can detect, how you can get tests for blood of lungs.
You're breaking quite a bit there, but I did hear the first question about the difference between a dry and a wet cough. Can you have a dry TB cough?
Well, in theory, it's a possibility. However, a cough simply tells you that the lung is diseased. So when you're having a cough that is going on, or that, it needs to be evaluated. And there may be, not all cough is TB, of course. And so if it is, if you have a cough that's going on for a while, it needs to be, looked at to do that, because it may not be TB, but lung disease can predispose, a lung that is diseased can easily be infected with TB.
Definitely.
So if you're having a cough that is going on for a while, it needs to be checked up by the, right people that can help guide.
Okay, so back to the vaccine. A child is given TB at birth.
Yes.
How long does that last?
Okay, so the protect is usually once in a lifetime. BCG, okay. That's BCG, usually given once in a lifetime. And in childhood, it does, in addition to other things, of course, nutrition, good nutrition and all of that, it protects them against TB in their childhood, even growing up to a large extent. But like I said, the primary responsibility of that vaccine is to protect against severe forms of TB. So even if they get TB, it can become latent and not, become full-blown TB at that stage until they grow up.
It's good you're saying this, because the impression I had, and I'm sure a lot of people have, is that, I've given my child BCG, no TB for life.
No, that's not exactly true.
So there's some things you still need to do to make sure you don't get TB.
Definitely.
Let's begin to count them off.
Well, we've talked about intensive case finding, we'll talk about nutrition, we'll talk about generally living healthy, because eventually things like diabetes, things like hypertension predispose people to that. HIV, which, before 1980, it was thought that TB was actually on a downward trend. Nobody thought we'd still be talking about TB in 2023. But because HIV came on board, things like use of steroids, injection drug uses, creams that, we just heard about people using creams that have steroids in Sunrise this morning. Those are these things that, put people that have cream, they depress people's immunity and predispose them against that. Alcohol, tobacco. These are all things that anything you are doing that can affect another organ elsewhere is TB potentially waiting to happen. Because any organ that is failing suppresses the immunity. Nobody functions as one. So if the heart is failing, it's a risk factor. If the kidney is failing, it's a risk factor. If the liver is failing, it's a risk factor. So anywhere, anything that the body is not working optimally, it's a risk factor for TB.
Wow, I have learned something today. Thank you so much for coming to the show. That was it. That's just a wonderful place to end.
Thank you.
Thank you also for being there. And if there's nothing you're taking off of this, is TB doesn't protect you completely. BCG, that's right, does not protect you completely. You've got to live a good life, a healthy life. Thank you so much for calling. Victor and Joseph and the rest of you, have a wonderful day. I am Mary Alale Yusuf.